The first thing we did was to meet directly with the chief medical officer, and the very first thing she told us totally flipped us upside our heads.
This is not an MRI problem, this is a problem with opiates in our communities.
We met directly with patients so that we could co-design with them about their experience with back pain.
People want to be heard. They have opinions, they have stories behind what's going on.
They were super clear, like, we don't want pills. We're not addicts, we're sick of pills too. There's got to be something else.
So we decided on a three-pronged approach to use the waiting room as a stretching room, to have data dashboards that provide primary care providers with what is happening at the population level. And then our third solution is the care plan that the patient and provider fill out together.
My advice to somebody who is new to the prototyping process is don't be scared. Paper is relatively inexpensive.
I am not likely a person to cut out figurines and create a physical model, but I think that it's a creative part of the process and I did enjoy doing it.
For our stretching room, because we were thinking, oh, cushions and pillows and mats and stretches, it'll be beautiful. And then somebody completely practical at the clinic goes, yeah, and who's gonna clean it so that it's, we don't have the germ issues? Like, oh, hadn't thought about that.
With each iteration, and for some of them, we had 5 or 6, the product itself just got more articulate. It met the need better.
With prototyping, you have to understand that people don't think your baby is as pretty as you think it is, and that maybe it needs a haircut and different clothes and wipe the drool from its face.
When you're trying something new like prototyping, it's really important to just keep it simple from the beginning, and you can add in more layers.
Go over and change and tweak and ask and just keep doing that cycle of feedback.
Working with stakeholders and hearing their stories helped you rethink about the narrative in your mind.
We didn't feel the pressure to bring them something shiny and polished because they knew going in that we wanted their feedback the whole way through. So people feel like they're a part of the design process, and then they're more likely to embrace the end solution.
Had we started with, oh, we saw a spike in MRIs related to low back pain, that's wrong, stop doing it, we wouldn't have got to any solution and we wouldn't have engaged the people that are actually in the clinics.
You don't have to do all the work at once all by yourself. And that's the best part about human-centered design.